Good evening to everyone present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by your keynote speaker, doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Ved Chaturvedi. Sir is MBBS, MD, DM, Senior Consultant at Sir Gangaram Hospital, and also a vice president at Asia Pacific Rheumatology League. Now, with the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is Beyond Dryness, Unmasking Sjogren Syndrome in Every Clinical Practice. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, Sir.
Thanks. Thank you very much for introduction. This is me, and this is my hospital, Gangaram Hospital, and I'm speaking on a subject which probably we were missing for many years. Sjogren syndrome is a disease. Uh, Actually speaking, Sjogren syndrome has a dryness of mouth and dryness of eye, but these symptoms are very common. That's why if you ask anybody who has a dry eye, dry mouth, he says yes. So that's why nobody takes it seriously without realizing this disease is not dryness of mouth and dryness of eye only. It is a much more, it is something like SLE, where there are multiple systems are involved. So you have more systems involved, so they are called multi-system disease. Look, when we were in medical college, it was taught to us that you will have a Sjogren syndrome, who has a bilateral parotid. That everybody can diagnose the bilateral parotid swelling, but bilateral parotid swelling is a very rare, because they actually present either with a dry eye, and dry eye symptoms, I can tell you, if you ask anybody you have a dry eye, nobody will going to take dry eye. Even today I'm feeling no, some problem in the eye. So if you ask me, can you describe your symptoms, very difficult to describe your symptoms. If if the lacrimal gland does not behave properly, then the dryness of the eye, they present in a different way. They can present as a foreign body sensation, some heaviness in the eyes. So that's why sometimes patients say I have a heaviness of eye, and you can't make out it as a Sjogren syndrome. So probably symptoms are different. The symptoms are not dry eye. So classically, the as per the book, the Sjogren syndrome is diagnosed by symptoms of dry eye and dry mouth. And I can tell you, not a single patient is going to take dry eye and dry mouth. Maybe this is more of a Western world. Dry eye in our language will be something like, Doctor Saab, I always feel little heaviness on my eyes. Doctor Saab, I have little foreign body sensation. I've got a little irritation. I can't see properly. I can't concentrate on the TV. So that is how the dry eye is. Dry mouth has a more issues, in fact, which I'll tell you how it is. Nobody is going to tell you the dry mouth. They will say that I have a problem in the taste, problem I can't swallow, problem is in my teeth. So in a different way they present. That's why the disease is missed. And not only the disease has a dry mouth and dry eye, unfortunately it can affect every organ, because the antibodies, they can attack your brain, so you have a brain fog. They can attack your eyes, so you have dry eye. They can attack your mouth, so you have dry mouth. They can attack your ears, so you have a hearing issue. They can attack your nerves, so you have a neuropathy. They can attack your skin, so you have a skin issues. They can attack your lung. So it's a multi-system disease. You must remember, it's a very, very important to know that is not only dry eye and dry mouth. So patient go to different specialty. Sometimes they go to lung specialist, sometimes they go to skin specialist. So all of us has to remember about this disease very well, that yes, multi-system diseases in autoimmune diseases are, one is SLE, another is Sjogren syndrome. So the dry mouth, as I was telling you, they can present in this fashion. That somebody might say, I have a burning sensation in the mouth. Somebody say, I have a dry lip. Somebody will say intolerance to acidic and spicy food. Somebody is taking antacids, thickened saliva, or impaired taste, or difficulty in wearing dentures. And everything requires saliva. Even if I'm speaking, if my saliva is not sufficient, I can't speak. And even dental health, that your teeth also requires, and your chewing, your swallowing, speaking, all, they may speak, but after 5 minutes they'll be tired. So that is how the it is diagnosed. Very, very important to do that. Oral manifestation, they can present to the doctors like, look, I have dryness of mouth or these symptoms, and what are the causes. Sometimes besides Sjogren syndrome, there are many other causes. Probably the most important cause of dryness of mouth is psychological factors. Sometimes you feel dry when you are not happy, you are stressed. This can be diabetes, there can be dehydration, you have not taken since mouth. So there are other cause of dryness of mouth, and some medicines, antihistamine, antihypertensive, some diuretic, they can also cause dryness of. So you must remember, dryness has many other reasons also. Otherwise, Sjogren syndrome can present not only dryness of mouth, they can present as a bad teeth. Believe me, most of the physicians, since they feel that I'm not a dentist, why should I ask about dentistry? You must ask. If you're suspecting a multi-system disease, especially Sjogren syndrome, you must ask about the dental health. Inspect yourself. You don't require a dentist to do that. Whether so unusuals, especially incisors, we have seen. I've learned now that front teeth are involved more in this. Of course, other teeth are also involved. So basically, for health of teeth, you require a good saliva. So that's very important. The As I said, dryness and dryness of mouth, and eye dryness can be also because of many issues. Eye dryness can be because of aging. If you're old, then your eye becomes dry. Like my mother-in-law keeps telling me, my dry eye, dry eye. Some corneal surgery after cataract, you become the your eye become dry, and so many causes I have written here. Dry eye. So it's not only neuropathic causes. Sometimes diabetes can cause. Sometimes some medicines can cause conjunctivitis. So many. And because this gland is here, and this gland secretes something which makes your eye wet. So that is very, very important. The Now, how to measure? Suppose somebody say, I have a dry eye, and my junior doctor say, nahi, nahi, sir, he does not have dry eye, he's just telling like this. So that's why the most we have evolved a, a, a system how to measure the dry eye, and this test is called as Surmer test. Now, if you don't remember the name of the test, you must remember that it is a very simple thing. You put a blotting paper and see how much it is the how much wetting becomes in, say, 1 minute. And they have measured it and they have standardized it, that if it is less than this, then it is a dry eye. So it is called Surmer test. And same way you can collect the saliva, that in 1 minute that much saliva. Tell me, they are so cumbersome tests. Who will do all these tests? That if you're collecting the saliva, so we want that something else should be to diagnose this disease. So gradually scientists, they if you ask me, this is how the criterias are there. In these criterias, you have some symptoms of eyes, which I told you, some symptoms of mouth, which I told you, and signs, which I told you. The eye signs are Sarma test, and for the mouth, this feel that you should do a lip biopsy, and in the lip biopsy, you demonstrate that the salivary glands are involved and there is a lymphocytic infiltration, and they have made a criteria which I don't want to bore you all the criteria, but just remember there are some criterias to diagnose yes, there is an infiltration by lymphocytes. And the the uh, that is how as on today it is these are diagnosed. And some antibodies like ANA, SSA, SSB, that is how the as on today this diagnosis. So but these antibodies, though people say ANA, if somebody has a dry mouth, somebody has a dry eye, and ANA is positive, and SSA antibody, the name is SSA, SSB, it is also called as Row and La. Now you don't get confused about the name of these antibodies. These names of antibody have been kept because they were first demonstrated in a patient. The patient name was Row and patient name was La. So these are antibodies name. SSA is called as anti-Row, SSB is called anti-La. But these are also not specific, bro. These antibodies are positive in many other conditions. Like they are positive in lupus also. They are positive in MCTD also. They are positive in many other conditions like myositis. So it means we don't have a very clear one single test which can say it is a Sjogren syndrome. So if you have dry eye, you have dry mouth, and you have Sarma test is positive, your salivary collection is positive, you've done these antibodies are positive, and lip biopsy is also positive, then probably you can diagnose, yes, most likely. But frankly speaking, we are still searching for more better and more less troublesome investigation. So difficult to diagnose otherwise, because these tests are very difficult to do. This is the history of Sjogren syndrome. That is, it is started gradually. They notice a dry eye, dry mouth, and over a period of time, so many things have been added. Especially, people realize that you must demonstrate objectively the dry eye. So the Sarma test and collection of salivary flow. Then came use of anti-malarial, then lip biopsy, that is a lymphocytic infiltration. And over a period of time, people learn and antibodies. So basically, scientists keep adding something or other. It's not a story of one day. The story started almost in 1882. So it only shows science slowly progresses. Sometimes we feel, why can't we find out in one day? But science is one which gradually, this man, Sjogren, he's the man who uh, uh, did so much work on the Sjogren. That's why it's called Sjogren syndrome. And the ultimately all of us agreed that if you do a labial biopsy or lip biopsy, and if you demonstrate the focal lymphocytic infiltration, and it is defined by foci of lymphocytic infiltration containing 50 or more cells, the number of lymphocyte foci normalized to 4 millimeter to glandular. Even if you don't remember this, is just remember lymphocytic infiltration, which has been some criteria has been given. Especially one focus means 50 50 lymphocytes, so that has become one focus. And you measure these focus, and in the 4 millimeter area, and then a score of one focus per 4 millimeter or higher correlates strongly. So even if you have one focus in 4 millimeter area, and that is important, that is how it is significant. So this is how it looks like, that is how it is diagnosed. So clinical features, as I said, beside dry eye and dry mouth, There are other features just like SLE only. They have other features like they have they have they have neuropathy, they have kidney involvement, they have lung involvement, they come with the cytopenias. So all whatever system you start from brain, they present with brain fog, they present with fatigue, they present with the central pain syndrome. You come to the eyes, which I have already told you, nasal dryness, so they will come with various symptoms. Mouth, I told you. Ear, I told you, they can come with the ear involvement, so lack of hearing. Nerve involvement, they can have a trigeminal nerve, other neuropathy. You come down, lungs, so interstitial lung disease, they have a lot of acidity, pancreatitis, you name the system which is not involved. So Sjogren syndrome is a disease where you can really miss, but must remember, at least I know this audience may be knowing good about lupus. Generally like lupus, but in addition have significant dry eye, dry mouth, and that is how you diagnose Sjogren syndrome. So that is the so these are the, you can have arthritis also, you can have involvement, you can have skin involvement. In fact, other day only I had a patient, Raynaud's they can have, exactly same like lupus, every symptom, every involvement, and basically more females than male, and 40 to 60 years, so not young people. So SLE, if somebody come, if some younger person comes to me and they come with these symptoms, I always feel an ANA positivity. I always feel probably it's SLE. But if some older person comes, middle aged, probably I feel it is Sjogren syndrome. That is how I learn about Sjogren syndrome. That in Asia, low prevalence of Zika symptoms at presentation. That is the uh, generally you can have a primary Sjogren syndrome. You don't have any other disease. You can have secondary Sjogren syndrome. Secondary Sjogren syndrome means you have ankylosing spondylitis, you have dryness of mouth also. So probably these antibody attack your mouth and attack your glands, and so that's why these glands, they don't function properly, and sometimes they can present as a parotid gland, as I told you. And parotid gland enlargement can be bilateral, just seen in 30%. So not many, every patient will not have. So if they are progressive, then you must exclude lymphoma also. And other condition, other causes can be also there, like you have seen, parotid gland can be involved in viral infection, and it can be involved in lymphoma. Extraglandin is the non-specific symptom which I told you: arthralgias, myalgias, fatigue, Raynaud's, uh, and some specific symptom which I told you: persistent fatigue, joint pain, muscle pain. They can present as, so it can involve joints, lungs, it can involve the kidney, it can present as vasculitis, it can present as a neuropathy, brain fog, and so on. So every system can be involved. So this is how they can present like this and go to the dermatologist. They can present like this to the lungs, they can go to a lung doctor. They can have cutaneous involvement, they can have purpura, they can have involvement of the many other skin things can be there, paniculitis, fibrosing alopecia. They can have systemic vasculitis, they can present a small vessel vasculitis like skin peripheral nerves. And so vasculitis, they can also present as a, of course, muscle diseases, they can have present as a, they can have even 5 to 10% patient have anti-CCP antibody. Now what do? You feel is a rheumatoid arthritis? No, they can have, they can sometimes have a severe arthritis. Otherwise, generally, they don't have that severe arthritis like rheumatoid arthritis. Pulmonary involvement, I told you that they can have the interstitial lung disease, and they can present as dyspnea, cough, and sometime I think there's something, some problem with the slides. Just a minute. It is, yeah. So they can have neuropathy. I told you. They nerve involvement can be there, and uh, they can present with hepatitis, primary biliary cirrhosis, endocrine involvement, and some gynae issues are there, renal involvement, I told you, and hematological cytopenias they can involve. And the criterias, the highest point has been given, the weightage has been given to the biopsy. So if you do a biopsy and focal score is more than 1, I told you, you do a lip biopsy, so this has been given a higher score. If you have antibodies positive like anti-ro or SSA antibodies, this is, and if you have symptoms like eye Sika symptoms or Sarma test, they also. So that is the. But you must remember, the more weightage has been given to the lip biopsy, and more weightage has been given to the anti-Ro SSA antibodies. So that's you must remember that. These we'll skip these about antibodies and classification criteria. I have already told you, and of course exclusion criteria. Other cause of dryness of mouth and dryness of eye should be excluded, and this we can remove. Salivary gland imaging is very important. So that is what we did. We are doing this job for last 8-10 years, that if you do ultrasound of the salivary gland, so they look like this, like a honeycomb, and these are grade 4 changes of Sjogren syndrome. And now we have become master gradually in this to diagnose. I'll tell you how they look like normal. You can do MRI also, you can do a CT also, but ultrasound is, we started doing ultrasound from 2003, and since that time I was in army hospital that time, and over a period of time we learned that you do a parotid ultrasound, and parotid ultrasound can also pick up. Then gradually even papers start coming, and they say the usefulness of salivary gland. The We published this is last year we published the paper on intake on the ultrasound of the parotid. So that is the parotid gland is here, and do you put a probe there and you can see the this is normal. This is how normal, it's like normal liver, homogeneous you can see, and it is hypoechoic. And then gradually changes are grade 1, grade 2. There's a lymph node also which is normal, so you can have a grade 1. The scoring system by omrect, this omrect is scoring system, grade 1, grade 2, grade 3, and grade 4. So basically grade 1, grade 2, grade 3, this is more severe, roughly like NYHA class 1, class 2, class 3. So basically the homogeneous portion gradually become anechoic and hypoechoic area and inhomogeneity. So normal is homogeneous, this is inhomogeneous. Normal is hypoechoic, they become anechoic. So that is how we do it, and gradually fibrosis sets in. So some clinical example I'll give you. Just I'm going to finish in 5 minutes, that this is how the Sjogren syndrome looks like. And otherwise it can have some differential diagnosis as adenoma, and sometime you can have Verdein's tumor, sometime you can have NHL, and sometime you can have, you are thinking about primary Sjogren syndrome, but if you do a biopsy of the gland you can see the NHL. So the ultrasound is very very important tool. That is how we conclude that it's a very important tool to diagnose the Sjogren syndrome. So ladies and gentlemen, I finished there because my time limit was 20 minutes. It's already 30 minutes. Just to summarize, the Sjogren syndrome is a disease which is not only dry eye and dry mouth, it is a multi-system disease. This is one message. Multi-system means every system is starting from brain to the nerve, to the skin, to the thyroid, to the lungs, to the liver, to the pancreas. All systems are involved. So if you want to learn about Sjogren syndrome, you should you should not remember only dry eye, dry mouth. Yes, it is easy to pick up dry eye and dry mouth. And how it is confirmed? That it is confirmed by antibodies. So you do a ANA, which is positive, and do a Rho and La, that is also positive. So you start severe doubt. And if you do a lip biopsy, then lymphocytic infiltration around the salivary gland, which is more than one score. So that is how it is diagnosed. Gradually, what we did our work for last 7 8 years, we realized that lip biopsy, not many people agrees for the lip biopsy, because they always feel there must be some problem, they may be cutting my lips. Though lip biopsy is also very simple, it's a OPD procedure. You just do a little nick and take out the salivary gland. So it is a very simple procedure. You can, if you can convince, if you can't convince the patient, then send for the ultrasound of the parotid gland, which I explained to you that normal gland is homogeneous and it looks like a hypoechoic. And gradually this gland, there are changes, and this homogeneity is converted into inhomogeneous, so it becomes non-homogeneous, and gradually it becomes like black, more black, like honeycomb. So that is how probably it will replace lip biopsy. But as on today, that day has not come. Even today, we give more weightage to the lip biopsy, and we give more weightage to the uh, to the uh, uh, to the antibodies. So that is how the treatment of Sjogren syndrome is something like lupus only, that you treat with a steroid, you treat with some drugs which affect the immune system and correct the immune system. So you can use methotrexate, you can use the steroid, you can use rituximab. We generally use rituximab. It gives very good result. Thank you so much. If you have some question, that may I can answer. Thanks.
Thank you so much, sir, for this wonderful presentation. Sir, we do have some question if you like to take that up.
Yeah, yeah.
So, sir, the first question is, what are the key red flag that should prompt suspicious of Sjogren syndrome in clinical practice?
Yeah, what though your voice is not coming clear, what I realize ki how you pick up in a busy OPD. So I always pick up in OPD if a lady walks in about 40 50 year old and has something. As a clinician, you have vague symptoms. Now, what is a vague symptom? Aches here, aches there, some problem in the mouth, some problem in the eyes, some problem in the hairs, multi-system. Doctor, Saab, I lose hairs also. They don't come directly, but if you sit down with the patient, so multi-system involvement, that is number one. Dryness of mouth, you must ask directly, and you must examine the teeth directly. You must ask the dryness of eye, otherwise send to your colleague in the ophthalmology department. They will say so dry eye, dry mouth, hair loss, arthritis, and sometimes skin involvement like purpura and neuropathy, and sometimes the kidney involvement. They can You can pick up the Sjogren syndrome like this.
Thank you, sir. There is another question. How does Sjogren syndrome manifest differently in pediatric patient, men, and elderly individuals?
I couldn't follow whatever you said, but how it differs from.
Yeah. So, sir, how it differs
Mhm.
in pediatric patient, men, and elderly patient?
I think you can send me a WhatsApp either on my number or my PA's number. Now, WhatsApp, because
Sir,
I can't. Your voice is not very clear
okay,
about
sir.
the
I'm
question.
I'm posting
I
it
could
in the
make
chat
out.
box. I'm posting it in the chat box, sir, so that you can see the question.
You just send me a WhatsApp. I think then I can
Sure,
read
sir.
your question.
Sure, sir. Just give me a
I
moment.
can't hear your. Or you can in the chat box you can type if you
Yes,
have.
sir. I'm doing that.
How does Reynolds? How does Sugram manifest differently in pediatric patients,
Patients.
men and elderly individual. Okay, so pediatrics, men and okay, by and large same. It is just it is difficult to pick up in elderly, and because their description. Now everybody feels old age will have automatically the aging itself can cause dry eye. They can aging can cause dry mouth and dry eyes. So you have to sit down and ask about since how long. He says since when I was age of 40, I have a dry eye, dry mouth, and I have lost my teeth. So then you can pick up in the elderly. In the man also generally they will present as a same dry eye, dry mouth, and sometimes they will say whenever I go to the meeting, after some time after speaking for 5 minutes, my mouth become dry and I can't speak. And some patient will say the eye specialist has prescribed me drops and I keep putting drop for last many years. So that is how they can present. Sometimes you are lucky that if they present as some subtle swelling of the salivary gland, but otherwise they can present as interstitial lung disease. They can present as a pancreatitis. Sometimes they can present as cytopenia like lupus. In children, I have seen other day I had a child who had generally it's very difficult to diagnose in children, but otherwise they will present as a either they will present as a little swelling here, or they can present as some foreign body sensation in the eyes, or they can present as some interstitial lung disease or maybe neuropathy. But I have not seen much children. I'm not a pediatrician, but that is what, because since I saw two children recently, so they can present as that. Another question is what are unique challenges in diagnosing the and and treating Sjogren syndrome in pregnant women. Like, look, any rheumatological condition, if you're dealing with the pregnancy, the main issue comes with the pregnancy is uh, the child, the safety of the drugs. So the rituximab, we don't know whether, so we don't give to rituximab. Methotrexate we don't give. So we choose a drug which is safer. So if what are the safe drug? Hydroxychloroquine is safe. Azuran is safe. So you give azuran, you give hydroxychloroquine, but don't give rituximab. Don't give your drugs like methotrexate. So safety is number one. That is one challenge. Another, of course, is the not only dryness of mouth and dryness of eye, dryness of the vagina. So that is about the issues in the husband wife relationship. So that can cause the issues. Uh, I think that is a in the about the another question is coming on the screen is the what consideration should be made regarding the long term use of medicines to minimize the side effects, mm, uh, and comorbidity. What consideration should be made regarding the long term use of medications in well the and comorbidities, minimize the side effects. You choose a drug which is safer. So anything like suppose I am diabetic, I am blood pressure, so I should take a drug which I can first thing I should be able to tolerate it. There's no point taking a drug and next day there is a nausea. So we give methotrexate and ask patient, you come after 1 month and we'll see whether you don't should not have nausea. If you have nausea, we'll change the drug. So one thing is the tolerance, another thing is safety. So we always say after 1 month you get a CBC, creatine, SGPT means liver test, and the kidney test and the bone marrow, and then see that it should not affect these organs because they are the vital organs. Liver is a vital organ, kidney is a vital organ. So we do these tests initially every monthly or 2 monthly, and then we understand, okay, this is safer. So every drug which you are writing with a methotrexate, you should know. Like ajuran is safe in pregnancy, hydroxychloroquine is safe in pregnancy, But all individual drugs has its own problem. Like Azurod has a lot of side effects, so that's why you get those genetic tests before giving Azuran. Rituximab is the biggest problem once you infuse it. Rituximab is a very safe drug, but if you use rituximab, I was the first one to use in this country. Rituximab was an army hospital. That time used to cost very costly. So when I gave to 20 people in rheumatoid arthritis, of course, and this was not effective because I was comparing with infliximab. Infliximab acts very fast. Rituximab takes 3 4 months, 2 3 months. So you should know, if you're giving a drug, you must read about the drug. So that is how the safety is decided. If you read about the drug and then give, then you are happy. Otherwise, you keep using it and you'll be. So I thought rituximab does not work, and I wrote a paper that rituximab does not work. But after some time, I realized it works little later. So that is how the safety consideration is. If you read about the drug, a molecule, you are better off.
Thank you so much, sir. We are done with the question. That's all from our audience.
Thank you so
Sir,
much. Jain.
thank you,
Yeah,
sir. Before
all
concluding, sir,
yours. Yeah.
any take home message from your end?
I think I can't hear your this thing was the voice is getting cut. Thank you. In any case, what I understood, we have finished, and thank you so much, Jahin.
Thank you, sir. Thank you so much.
Okay.